Hey everybody, and welcome back to Captain Jasper. Today I'm going to be going through 5 of the most common illnesses rabbits are prone to. Don't forget to like, subscribe, and turn on those notifications so you don't miss part 2 of this video or any of our other uploads. Usually caused by either an ear infection like Alice had or due to a parasite called E. caniculi. Signs and symptoms usually include shaking their head, loss of balance and convulsions, lethargy, not eating, and becoming immobile. Luckily, as severe as this condition can look and be, it is usually very easy to cure with immediate vet treatment and the right medication. Some bunnies with head tilt caused by the EC parasite often retain the head tilt, but go on to live long and healthy lives. Bunnies with head tilts due to ear infections, like Alice's, can often have full recoveries, and their head tilt will get better with the right medication and vet treatment. The reason why bunnies with head tilts due to EC parasite retain their head tilt is the parasites actually eat away and damage their brain, nervous system, liver, kidneys, heart, and sometimes their lungs. And once the damage is done, it is often irreversible. That is why it is essential to seek veterinary treatment from a rabbit-savvy vet as soon as possible if you suspect your bunny has a head tilt. To prevent head tilt from the EC parasite, you can use a wormer called Panacur, up to 4 times per year. Panacur is an internal and external wormer that will help prevent an array of parasites causing harm to your bunny. I highly recommend using it or another similar bunny-friendly anti-parasite protection that prevents from both external and internal parasites. Often the spot-on anti-parasite treatment for rabbits only protects against external parasites, like fleas and ticks, but this one will help prevent against internal bugs as well. To prevent head tilts due to ear infections, check your rabbit's ears regularly for wax buildups, and regularly feel for lumps, swelling, or an increased temperature of one or both of the ears. This can often be an early indication of a wax buildup that can lead to an ear infection and a head tilt. Never stick anything down your rabbit's ears to clean them. If you suspect a wax buildup, take your bunny to a rabbit-savvy vet to inspect further and show you how to properly clean them. Lop rabbits are much more prone to this issue due to their physiology. Urolithiasis or bladder stones. Sludgy pee, known as bladder sludge. Hunched position. Not eating. Not moving or looks like they're in pain when they do move. A bulgy and hard bladder. Now, I've talked about this condition a lot in past videos, but it's so important to mention, as it's one of the most common conditions vet practices see in rabbits. When I was studying, I ended up doing my dissertation on rabbits' drinking habits, and did a study on whether rabbits prefer to drink from bottles or bowls. We already know from past studies that bowls provide a much more natural way of drinking, that rabbits can actually obtain more water from a bowl compared to bottles when drinking for the same length of time. And also bowls are a far more hygienic way to provide your rabbit water, as often the spouts of bottles harbour bacteria if not properly cleaned. And there are a lot of other issues I found with them that I won't go into right now. My study found that the group of rabbits I tested my hypothesis on preferred bowls over bottles most of the time. There were a few individuals that would prefer to go to the bottles, but overall all 9 rabbits preferred bowls. Other animal researchers have also found similar findings when it comes to preference testing bowls versus bottles on rabbits and other small mammals. These studies also highlighted how the leading cause of bladder stones in rabbits was due to them not having enough water to flush out excess calcium, and therefore it was building up and causing the painful condition. There can also be other causes, such as a diet too high in foods with calcium. But statistically, the leading cause is low water intake, presumably due to rabbits not being able to obtain a sufficient amount of water through bottles. Now, if your rabbit simply refuses to drink from a bowl, don't fear, as some bunnies just prefer bottles. And you can help ensure they get enough water by providing more than one bottle, regularly checking the spouts for obstructions, and that they're still working, and also cleaning them thoroughly and changing them when appropriate. You will need to seek veterinary treatment as soon as possible if you suspect bladder stones, so your vet can assess how bad they are and if they need removing surgically by a procedure called a cystotomy, where a small incision is made in the bladder and they can remove the stones, or if they're small enough to be broken up and flushed out. This condition is extremely painful and if left untreated can be fatal. Snuffles. Runny eyes, runny nose, sneezing, reduced appetite, wheezing, hard to breathe, discharge from the nose and sometimes the eyes. Many people mistake snuffles for just a cold, but rabbits don't actually develop colds. Well, at least not how humans do. Snuffles can be caused by a chronic bacterial infection in the tear ducts and nasal sinuses. The bacteria are generally Pasteurella, but can be caused by other bacteria as well. This condition is highly contagious and can be quite serious if not properly treated by a rabbit-savvy vet. Often your vet will prescribe antibiotics and possibly also a nebulizing device to get the antibacterial agent where it's needed. GI stasis. Hunched, small or no poos, not eating, bloated stomach, hard, lumpy or squishy feeling stomach, lethargic and dehydrated. This condition can quickly become fatal if not treated by a rabbit-savvy vet as soon as possible. GI stasis is where the rabbit's digestive tract has slowed down or in severe cases completely stopped. Often this is caused by poor diet, but can also happen recurringly to some bunnies due to their genetics. Your vet will need to help get your rabbit's gut moving again, and will often give them a motility-modifying drug to help encourage movement of food through the stomach and intestines. This is administered orally, but if there is a large blockage, your rabbit may need surgery to clear their intestines. To help prevent GI stasis, ensure your rabbit has the correct nutrition and a diet rich in hay. Fly strike. Hunched, lethargic, not eating, larvae or blood coming from their rear end. Fly strike is more common in the summer months, but I like to protect against it all year round just to be safe. Fly strike is where flies lay eggs, usually in the rabbit's rear end or in an open wound on your bun, and within 24 hours the eggs will have turned into larvae and started to burrow into your rabbit, causing extreme harm and pain. It can often lead to death, especially if you do not seek veterinary treatment as soon as possible. It is so important to check your rabbit's bum daily for any droppings stuck in the fur that may attract flies, to change their litter tray regularly, and also to keep their enclosure clean. If your rabbit's droppings, not their secretropes but their actual droppings, are wet and sloppy, this can also attract flies. Try cutting down wet foods from your bunny's diet and upping their hay, along with talking to a rabbit-savvy vet about the issue if it lasts longer than 3 days, after making adjustments to their diet. You can also use a spray called Fly Strike to help prevent this condition and keep flies at bay. I like to do this every 3 months. I go into detail onto how to check your rabbit's bum and give them an overall health check in the video in the top corner, so don't forget to check that out if you haven't already. Sadly, if your rabbit develops this condition, mortality rates are high. This is why prevention is so key with this condition. Thanks so much for watching. Don't forget to stay tuned for part 2 and we'll see you next time.